Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery, and I've been practicing in the Scottsdale Paradise Valley area since 1992, and that's all I do. I just perform cosmetic or aesthetic plastic surgery. I do a lot of facial cosmetic surgery. I do a lot of facelifts and neck lifts and rhinoplasties and eyelid surgery and fat transfer. And a common question that I get both from men and women is, Dr. Shapiro, can I get improvement in my neck without a neck lift or a facelift? And the answer to the question is depends. Everything is dependent upon skin tone and anatomy, and depending upon what people are looking for and what age they are will kind of tell me what I can do for you. In somebody who's younger that has some fullness or lack of definition in their neck, oftentimes liposuction can be performed. Now, why is that? Because that fat can be removed with a much more predictable result in the skin. When somebody is younger, they have better skin elasticity, hence I can predict what kind of result you'll get. If I want to see a more graceful jawline, better definition along the jawline, and a better what we call cervical mental angle, oftentimes I can do that with liposuction. Of course, we don't want to skeletonize you. We don't want to take out too much fat, so that is where the experience comes in. We want to give you a beautiful result. The great thing about it is it's done through a very, very small incision and no one's the wiser. In patients that are a bit older, there are things that can be done to improve that contour without a facelift or neck lift, and that can be a combination of procedures. If somebody needs some more definition along the jawline or the chin, oftentimes I can do some fat transfer in that area. But if somebody needs significant volume in the chin area, chin augmentation will help make that neck look better. There are some non-invasive treatments that can give you some moderate results or good results without having a neck lift or a facelift. And again, the better the skin tone, the better the result. In patients that are older, that have poor skin tone, that have bands in terms of turkey gobbler, the only thing that's going to get a great result is a neck lift or a facelift. But in that window where people have moderate skin tone, there are some non-invasive treatments that can be performed. The first is something like some laser treatment to help increase the skin tone on the neck and the lower face. The other thing that can be done is some Botox on those bands or some soft tissue fillers to help increase the definition of the jawline. When the Botox is put in a very cosmetic and in a very thoughtful fashion, we can almost get a neck lift from that procedure. That's called a Nefertiti lift. And Botox is put in on the neck and the lower jawline to help get a lift out of that. Oftentimes that's combined with soft tissue fillers or other non-invasive treatments. One of the treatments that we've been so excited about in the last 5 years is something called Ultherapy, and that uses ultrasound to tighten the skin and the muscles very much in the way that a neck lift will do. Again, not in the same extent as a neck lift, but in people that need moderate improvement and have moderate skin tone, Ultherapy is a great procedure, and it can be combined with Botox and soft tissue fillers. And lastly, we're excited, since April of this year, there's been an FDA approval of something called Kybella. And Kybella is an injection of deoxycholic acid that will dissolve the fat in the double chin region. It's not a one-shot deal, it's a series of injections. Usually people need about 3 or 4 injections a month apart, but we've seen very, very nice results with improvement of that double chin and secondary skin contraction. As in other surgical procedures or the other procedures we talked about, those people that have nice skin tone, that have fat localized to just the submental area are the best candidates for Kybella. Those patients that have a lot of heaviness in their neck or have extra skin that cannot snap back, you're not a good candidate for Kybella. So the best way to figure out what could be done for you in terms of your neck or lower face, if you're trying to avoid surgery but you don't want to be disappointed, the best thing to do is come in for consultation. I will talk to you, my estheticians will talk to you, my nurse injector will talk to you, and we'll come up with a plan for you that will hopefully exceed your expectations. Thank you.